You're live, Beto.
We're live. Molly is our camera operator today. Molly, you want to say hi real quick? Huh? Well, I mean, but they'll see you in a second. John's on.
Hello.
Yeah.
Hi.
And so
No, he can't see you.
You have to like come into where the camera is.
Hi.
There's Molly, briefly. Hey, everybody. We just wanted to check in. We wanted to say hello to all of our friends out there and the folks we've had a chance to work with and volunteer with and just know who are also on Instagram, and just check in, see how you're doing, do a radio check from El Paso and share with you how we're doing. And in a little bit, I hope if we can make this work, we're going to be joined by Sister Christina, who is in New York and is, along with her husband Nick, on the front lines of this. She is working at a hospital in New York, and Molly's looking at some of the comments. Don't read this. Some of these are inappropriate. Don't read these. So we hope to get her in, but we wanted to give you just a quick update. First of all, everyone here in Casa ORourke is great. Everyone's healthy, doing well. Amy's got us on this great regimen of outdoor hikes. You took us down to El Paso High.
Yeah, biking.
Rode bikes down to El Paso High, and then we competed in different events that you set up, including the long jump. We volunteered with our friends Gwen and Chris and Michelle and Jim and Christine at El Pasoans Fighting Hunger. So this may be the case in your city, and it certainly is the case in El Paso. There are a lot of people who need help right now, need nutrition, need calories, and it's harder than ever for them to get it. For example, in El Paso, all of our senior citizen centers, where a lot of seniors go to get lunch or nutrition or meals, those are all closed down right now. So along with our kids and these other families, we went down and volunteered at El Pasoans Fighting Hunger. That's our local food bank, and we packed boxes full of canned salmon. Molly, what was your station?
Peaches.
Pears. You had pears and beans.
And flour.
Flour, and you had nuts and rice. Yeah. Anyhow, there's a good chance in your community that your local food bank will still need your volunteer support to pack boxes like these, to make sure that they're distributed to people in need in the community. Call your local food bank to find out. Our local food bank, El Pasoans Fighting Hunger, did a good job of keeping us, well, not Amy and me, but Amy and me from other people, more than 6 feet separated. They were very disciplined about asking us to wash hands and wearing gloves. And if you were to touch your cell phone or your face with your gloves, you had to go wash your hands, put on a new pair of gloves. So they were really meticulous about keeping us safe and keeping other people safe at that food bank. And I'm sure that is a similar procedure in food banks across the country. So that's one way you can help. If you are in a situation, you're a little bit older, you have an underlying health condition, and you should not be out at all, you can, and you have the means, you can also financially contribute to your local food bank. Again, they could use the help right now. Sorry, you were going to say something.
No, one thing I've seen on social media that I'm hesitant to say in front of Molly, but that I absolutely
Molly, go in
love,
another room.
Is that a lot of people have been adopting dogs and cats because they know that they're going to be at home for concentrated periods of time, and they want the companionship. And I think that's awesome also.
Yeah.
But
so are you now saying we're going to adopt some?
We're not, but I'm glad other people are.
Molly is applauding that. Our good friend Maggie, who has an amazing restaurant in El Paso called Salt and Honey, has helped start an El Paso Food and Beverage Workers Fund. As you know, a lot of small businesses are having to temporarily close or just completely shut down. Not only is that hard for the small business and the small business owners, sometimes mom and pop operations run by families, but it's really hard on the employees, the people who make our food, who serve our food, who clean up after us after we leave. So in El Paso, there's an El Paso Food and Beverage Workers Fund, and you can look that up if you want to donate or find out more information about that. But kudos to Maggie and everybody who is part of that. And our thanks to everybody in the hospitality, the restaurant, food and entertainment business. These are the toughest of times for you. And I know so many are doing everything they can to persevere. So many restaurant owners being so generous with their stocks of food and with paying their employees for as long as they possibly can. So we're grateful to all of you who are doing that right now. A couple of other things. We've been really impressed at how people are entertaining themselves and entertaining us. Amy and I tuned in to the Luck Reunion. This is Willie Nelson and family's annual bash out of Luck, Texas. It was Thursday night. This year they had to live stream it, and so we had a chance to tune in. We heard Neil Young. We heard Micah Nelson and his band Particle Kid that played an amazing song. Lucas Nelson, Willie Nelson, of course. Ray Benson, who is the MC, who's Amy's all-time favorite. And that was fun. Molly and I listened to Leon Bridges earlier today, playing kind of an impromptu set, looked like out of his kitchen or his living room. And so, anyhow, thanks for everyone who's reaching out and trying to keep us occupied. Just want to reiterate before we ask Christina to join us, stay away from everyone, not in your immediate family. Don't go out unless you absolutely have to. Certainly don't congregate in restaurants or bars. Most of them are closed in many parts of the country. They're supposed to be closed in El Paso. A friend of ours, Chris, sent us a picture or posted one on Instagram of a bar that's still open with people still congregating. Don't do that. It is really dumb right now, not only for you and your health, but for the health and safety of everyone that you may come in contact with. So you may be young and strong, so you may not feel like coronavirus is going to affect you, but there's a very good chance, should you be exposed, that you could unwittingly expose other people who are more vulnerable and not as capable of withstanding coronavirus or COVID-19 and may succumb to it. So really be smart right now. It's a pain in the ass. It's hard. It's not as easy as we want it to be. But this is a really serious virus and we have to take it seriously. So please, please, please keep your distance from folks. Wash your hands repeatedly. Be safe and be smart. Lastly, before we ask Christina to come on, and part of the reason we're asking Christina to come on, our thanks to all of the healthcare workers out there right now who are on the front lines. That is the doctors and the nurses and the janitors and the frontline staff and everyone who is at risk of exposure as they try to help treat those who have been exposed, as well as those who were already in the healthcare system at hospitals who were in desperate need of help. We know how hard this is for you, not only because our government so far has failed to get the necessary testing to ensure that you can do your job effectively, but also in many cases you don't have the materials and supplies that you need to be safe. So we're very grateful to everyone out there who's in this really difficult line of work at this very difficult time. Okay, so
I think you want to hit that button right there and see if she's ready.
Okay. Okay, Molly, you're going to do that? Okay, Christina, you make a request to come in and we'll invite you into this video. This is the first time doing this, so we're innovating right now, at least for us. A lot of other people have figured this out. Some people wonder what the print is behind us. That's from Los Dos, really amazing artists from El Paso and Juarez. You can see their art up all around our community, and really cool to be able to have a print of this that we can have up in our living room. And you're asking who you're hearing right now. That's Willie Nelson and Leon Russell from a record that we just put on a little while ago. Molly, ¿qué pasa? Nothing. Okay. All right, we're going to see if Christina's on yet. No. Okay, here we go. Let's do this. Let's add her. All right. All right, we did it. Hey, Christina.
Hi.
So Christina is Amy's sister, if you all...
Can you see the resemblance?
Yes. And Molly's aunt. And she is a doctor practicing medicine in New York City. And so, Christina, we wanted to check in with you. Tell us, first of all, how you and Nick and Matthew, how your family's doing right now.
It's a really stressful time, I have to say. I have been thinking about this virus for a long time and its impact on my personal life, as well as the lives of thousands of millions of people in New York and across the globe, is much more than I ever anticipated. And I really never, my husband, for any of you who know him, is one of the most calm, wonderful, like, does not get anxious about anything, very much the opposite of me. And he's an ER doctor in New York. And I came home the other day and he had worked overnight and was visibly shaken. And he said, you know what I thought about in the middle of my shift? And I said, what? And he said, I don't have a will. And that was really hard. We have a 1-year-old son, and you know, for me, my work along with my family is the thing I get the most pride out of, and it sustains me. I feel like I'm contributing in a way that I've always wanted to. I feel stimulated, and I still feel that every single day. And it is a privilege to be a healthcare worker. I think everyone that is coming to the hospital each and every day, whether they're an environmental services provider, a food provider, a nurse, a doctor, all of us feel like it's our duty and a privilege to be there. And what is scary is that now we feel like we don't have the means necessary to protect ourselves and to protect our patients.
What does that mean? What are you missing that you should have right now?
So you may have seen, it's sort of starting to go around on social media, but there's a massive shortage of what's called personal protective equipment, or PPE, across the country. And New York is, you know, one of the epicenters in the country of coronavirus. And we have an unbelievably massive shortage, and it's affecting every single person that works in the hospital. And it's really affecting a lot of the folks who are taking care of our more sick patients. So folks working in the ICUs, working in the ERs, because if you need to have a breathing tube and a ventilator, which you know that's one of the feared ramifications of having coronavirus, it gets aerosolized. And so you really need what's called an N95 respirator to protect you. And we have enough for each employee to have one respirator. And for me, I am not going to be in contact that much with patients that have aerosolized COVID-19, but there's providers where they have countless patients a day where that's the case. And so it's scary. And, you know, never have I ever thought about not having enough personal protective equipment. I'm a pediatric doctor, and as any parent out there knows, kids get viruses all the time. And we use personal protective equipment all the time. And it's not just to protect us, it's actually to protect patients, because you're going to go from room to room seeing these wonderful families, and one patient is going to have a certain virus and the next patient is going to have a different virus, and the third patient may have no virus at all. And so the personal protective equipment actually prevents me from taking one patient's virus into the next room. It keeps me clean so that when I go see another patient, I'm not getting them sick. So what is scary from the healthcare perspective is, for the first time this week, I was scared to go see patients. Not because I was scared of getting sick. I would go see every single patient, but I was scared I was going to get someone else sick. And that's not why I became a doctor. I became a doctor to help people. And that is very anxiety provoking. The thing I will say that has been the silver lining of this crisis and pandemic, and then I hope outlasts this crisis and pandemic, is the overwhelming support I have from every single person in the hospital, from the very top leadership down to the folks at the security desk, to those cleaning the rooms. Everyone feels like we're in it together and we're leaning on one another. And we know that what we're doing is meaningful. And I've never felt so proud to work at my hospital. And everyone is doing their best to take care of the patients. And I just feel deep gratitude to be in the position I am, to be able to work in this hospital. And I think everyone around me feels the same. And I think that it really is permeating throughout New York. People are going to their neighbors' doors, slipping notes under their elderly neighbors' doors saying, can I pick you groceries up? Can I go get you like cleaning supplies? People are really being very generous and grateful to one another. And people are saying thank you to the grocery store workers whose work is essential. But how many days have, I overlook these people, and this is really giving me perspective that there's so many members of our community who are unsung heroes, and each of us really need to say thank you. And I feel like that's happening in New York, and it's incredible. And so although we're really isolated from one another, there's a sense of community and a spirit that I have not felt in my life before. And I hope that lasts. I really do.
Christina, I have to say, I'm so proud of you. Hearing you say all
you
this.
Should be.
I am. I really am, for everything that you've just said, and then everything that you're doing right now in the face of this. I wanted to ask you something about what this does to hospital capacity. Maybe just in general. I don't know if it's particular to yours or others, but in places like New York or Seattle, or other hotspots for coronavirus, what does this do for capacity to care for people who don't have coronavirus? I saw an article today about someone whose life-saving transplant is going to have to be postponed, maybe indefinitely, which means that he may lose his life. Are you seeing that kind of difficult choice, either in your hospital or amongst other healthcare workers that you're in touch with?
Yeah, I think our hospital has made the decision to stop all elective procedures, but any life-saving procedure will still happen. So that choice, there's cancer patients still coming in for their chemotherapy. There's children with solid tumors that are having those tumors removed. Those things are still happening. So we understand that the world is still turning aside from this virus, and we need to confront those issues as we always have. But there's children that are not getting procedures that would help them suffer less. It's not going to it's not going to be a difference between life and death, but it would be better to do those, perhaps for their quality of life, to do these things sooner. And we're not able to do that. And, children are spared proportionately compared to the adult hospital. But the hospitals are operating at max capacity 99% of the time before you have a pandemic. And now you're adding all of this on top of it, and it is very stressful.
And you mentioned the protective gear and not, was it personal protection equipment?
Yeah.
PPE?
The lingo's PPE.
PPE, okay,
personal
got it.
Protective equipment.
And you described what the consequences of not having PPE are. Not only could you get sick, but you could transmit a virus from one patient to another patient because you're not able to change the equipment that you have on. I've heard talk about washing or boiling this stuff so that you can reuse it. I think the president suggested that that's what you do. One, can you do that? Two, I've also heard from the president's coronavirus task force that private manufacturers are producing the necessary PPE supplies. It doesn't sound like that's actually the case in your experience so far. Can you give us an idea of just how bad this is and when you expect it to be better, or if you have any visibility on when it is going to be better?
So for your first question, these masks are made of paper, so you cannot boil them. It would be like paper mache, and you could do an arts and crafts project with it after, but you're not going to have a useful mask. There's also elastic in it, which would melt. So for sure.
So don't boil the PPE.
No. And the visors so the appropriate equipment for people that are in the hospital is a gown, gloves, a mask that has a plastic shield over it. If you don't have the plastic shield that's connected to the mask, you can also wear goggles or this visor. So essentially you're protecting your eyes and your mouth from getting the visor. And then the gown is because it's essentially droplets. So if you think about someone spraying perfume, that's kind of how the virus is spread. It's those little perfume droplets.
From coughs and sneezes.
Exactly. So by wearing a gown, you're preventing those droplets can get on you, but you're taking it off and you're not bringing it into the next patient's room.
Gotcha. And then when are you expecting to get, since you cannot boil the masks as they turn into paper mache, and you can't clean the masks you already have, when will you get the PPE that you need to keep yourself and your patients safe?
So currently we have, at least Friday, we had PPE, but for instance, if you have a bunch of patients with COVID-19, you don't need the N95 respirator unless they have some kind of breathing mechanism on. So I'll speak for pediatrics. As long as they're a stable respiratory exam, you don't need to put any kind of breathing apparatus on them. So you're fine with just the mask and the shield. And we are really critically low on those materials, but we have enough to take care of them. But we're limiting the number of doctors that can examine the patient each day. So, you know, a month ago, we did something called family-centered rounds, where me as the attending, I would go in, I'd have my senior resident, I would have my interns, my medical students, and we would round in front of the family, speak in terms that they would understand so that they really understood the whole reason why their child was in the hospital. They could ask any questions, the nurse is in there giving her input. It's a really beautiful multidisciplinary way to take care of a child. And now we are a patient, you know, if a patient is sick, we're going to examine them the same way we would before. But if the kid is stable and doing well, you really think about how many times you're going to go into that room. So it's changing the way we are thinking about patients. And that doesn't have to be a patient with COVID-19. Any child on isolation needs protective equipment, and we really need to be using it appropriately and judiciously. That's nothing that never entered the equation before. We would go in as a group of 12 people to each room and do these rounds, and we can't do that anymore.
Somebody from a friend of ours from Ohio, Storm, just asked, in a worst case scenario, could you use a scarf or a bandana to cover your nose and your mouth? I realize you still wouldn't have the visor for your eyes, but I guess that.
Yeah, so I think I don't know the exact number, but I think it's around 20% contagion can come through your eyes.
Okay, so you still need the goggles or a visor.
Yeah.
Gotcha. Okay.
And Christina, you were telling me something yesterday about one of the dangers for doctors is that you can have like an overload of exposure, and then that increases your risk of infection, which is problematic because then healthcare providers will be the ones getting sick.
Yeah, and so we've seen across the country, there's several ER, like young, healthy ER doctors who are in the ICU with breathing tubes. And the thought behind it, this isn't totally fleshed out in terms of their understanding, but what they hypothesize is that with repeated exposure, you can have high viral levels in your blood. And the more contact you have with the virus, the higher the levels go in your blood, and then that can make you sicker. So, you know, everyone is saying like it's only old people or vulnerable patients or patients with underlying health problems, but we're seeing healthy doctors who are getting sick, and they think it's because they're getting viral, they're getting what's called viremia, or viruses in the blood leading to high levels. Is one of the hypotheses as to why this is happening.
Christina, one of the things that has concerned a lot of people, concerns me, is the fact that we have been unable to test people in this country. We got an email from a friend from Lubbock who talked about her mother going in with all of the coronavirus symptoms. And this was at a hospital in Lubbock, and they sent her home and said, look, we don't have any tests, isolate yourself. And they sent her with an antibiotic. So one, we care about her welfare and whether she's going to make a full and speedy recovery. Two, we're worried that if she's not tested and she doesn't know if she has coronavirus, and then isn't tested, at some point, that she could spread that to others. And we're also worried that we won't have an accurate count in this country and know whether we have an emerging. Talk to us briefly about how important testing is, and then what the fuck, with the wealthiest, the most powerful country on the face of the planet, how did we not have tests? And South Korea has tests, and Italy has tests, and the European Union has tests, and China has tests. You're in the field. How did this happen? How do we not have tests?
The lack of testing is truly mind-boggling to people working in hospitals and across the country. And it's unacceptable. And you're absolutely right. We have no idea how many people have COVID-19. It could be hundreds of thousands of people.
We have no idea, right? No idea.
No
like
idea.
We see numbers, but I don't know if those numbers are real. Because if you don't have the tests, how do you know?
You don't know. And unfortunately, I think it's changing, at least in our hospital. Our ability to test this week has gone up exponentially. But in New York last week, they were saying they were testing about 150 patients a day. 150 patients a day in the biggest city in the country. And there are people coming that are, textbook. You can, betting individuals would say, I'm putting my money down that this person has COVID-19. But if they don't need to be hospitalized, we're not going to waste a test on them. And it's because having information about what viruses patients have in the hospital where there's vulnerable people is more valuable than saying, go keep yourself alone away from everyone else for 2 weeks. And as long as people are following that guidance and staying alone for 2 weeks, but what happens if you're talking to an 85-year-old woman who has dementia and she has a home health worker? And she's dependent on that person because she can't do her activities of daily life without someone living with her. You send her home and you say, I think you have coronavirus. Your home health aide can't come anymore. So you have to hope that they have a family member that's willing to live with that person and live with them with the risk knowing that they're going to be around someone that has this virus. And I think people have come together, and that is the reality, but it would be much easier if we could say, you have the flu, or you have a different virus, or you have COVID-19. But 2 weeks is a really conservative guess about how long from incubation to the end of symptoms and viral shedding. Viral shedding is a fancy word to mean like how long you have the virus and it's kind of in your particles and could be contagious. And so if you can keep someone alone for 2 weeks, the virus will die and then they're not contagious anymore. But there's a lot of people, especially young, healthy people, that may just feel kind of off one day. And maybe they had a bad night's sleep the night before and they said, oh, it's just because I had a bad night's sleep, but they could have COVID-19 and then they're spreading it to everyone around them.
Christina, what generation are you?
I don't know. I hope I'm not a millennial, but I think I might be.
What year were you born?
87.
87. So I see these pictures of young people congregating at beaches across the country, interviews with people who, I was probably this dumb when I was 19 as well, who are saying, I don't care if I get coronavirus. I've been planning spring break for 2 months. I'm not going to let this get in the way. And very often older generations will dismiss younger generations, maybe without acknowledging that they were as dumb when they were that age as well. I definitely was. But you're a generation younger than I am. You're being far more responsible than I am. You're doing this really important, necessary work. Can you talk a little bit about transmission and young people? And I don't know if there are, I assume that the young people watching this right now, people I would say who are like 15 to 25, are smart enough to do the right thing, to keep distance from anybody else, to not leave their house unless they absolutely have to to not congregate. But I think that might be, they were talking about spring breakers being super spreaders. I don't know if you want to talk a little bit about that.
Yeah, I mean, there was a New Yorker article that came out this week, and I think the title was "How to Get Your Boomer Parents to Self-Isolate." You know, I love my dad, and it took multiple angry, stern calls to get him to start working from home. I mean, he's
from all of us.
And that makes me worry. And I'm sure a lot of people out there feel the same way. I have to say, my millennial friends are doing a beautiful job self-isolating. And I think people are getting creative in order to feel connected in a time of being totally physically disconnected. We had my friend works for Cisco, and so set up a Cisco WebEx, and we had like the Brady Bunch 6 screens going up, and we had dinner together. It's a really amazing way to feel like you're not alone in this. But I would say I do see people all together, like really close to one another, and it makes me want to scream so loud. And then when I'm taking the subway home and the train is packed, and yes, there's a lot of healthcare workers that are on my route, but there's also a lot of people that are probably just taking the train. And so that's frustrating, because the whole idea is that by non-essential workers staying home, you're allowing essential workers, so people working at grocery stores, people working at pharmacies, people working in hospitals, so that they can use public transportation safely.
All right, Christina, we're looking at some questions that people, so I guess we're new to this version of Instagram. There's some questions, there's a feature by which you can post questions, a little question mark at the bottom.
I'm running out of battery, so I'm going to walk and plug.
Okay. Some questions about what we're doing for self-care.
Christina, what are you doing for self-care? Because I have to what you're describing is incredibly stressful, not only for you, but also for Nick, who's working in the ER. And so, how often are you all seeing each other? Are you having to pick up extra shifts? And then how are you figuring out a way to take care of yourself?
It's hard. And I'm frankly much more worried about Nick than me. I am incredibly lucky in that my residency program is the most supportive group of people I've ever been around. So like Friday morning, we had what's called Making Space, and we all virtually connected by WebEx and talked with one of our incredible palliative care social workers about how this experience is making us feel. A lot of people talked about, like, even though there's not a lot of volume in our pediatric emergency room right now, the stress of going into every patient's room, not knowing what's wrong with them and whether they could be sick, was extreme. It was paralyzing. And then other people like myself, when I'm hearing my husband talk about what it's like to be on the adult side and just seeing extremely critically ill patients come in and not feeling like you have the equipment to protect yourself and take care of them. But these doctors, nurses, their respiratory therapists, they're going to put the patient first, whether or not it's the right thing, like they can protect them, they're going to go to the patient. And hearing that he's worried about not having a will was really heartbreaking. And, I lean on Nick a lot, as you know, like he is my rock. And I realize like it's my chance to step up and have him lean on me too. And I lean on my co-residents. My co-chief, Francesca, she's the most remarkable person I've ever met. And I lean on her. I lean on my family members. And I really think that you just have to take stock in what you have in your life, lean on your loved ones. And the biggest thing I think that's been helpful is, how do I channel this into something good? How do I think about how this is going to affect people across the country and across the world, and think about those that are more vulnerable than me, those that are not in a position to use their voice or not in a position to give, and how do I let them lean on me? So Nick and I have been thinking a lot about, like, how do we think about the elderly folks? So the older men and women that might fall, and the ER is the place that they would go, and now they're too scared to go. So how do we help those people?
I just want to tell you, there's a lot, as you're speaking, you don't have a chance to read the comments. There's a lot of love for you. A lot of people say they're praying for you. Someone just declared their love for you, but you are taken. You're with Nick. That's not happening. Someone reminded me not to touch my face. I've been, having my hand on my face, as is my wont, but I will not do that anymore. That's the last time you see me do that. I thought I would just take one question. I know you all are getting your 1-year-old to sleep, and we caught you just as you were doing that. But there's a really good question from Andrean. I could be saying that wrong. I'm sure I am. How are things with refugees and guests at the Opportunity Center? So the Opportunity Center is a center for homeless in El Paso. And this other question about the refugees, would love for you to maybe take both of those. So we have homeless populations throughout the country, homeless shelters throughout the country. What precautions should they be taking? One, and then two, uniquely in El Paso, in San Diego, in McAllen, along the U.S.-Mexico border, we have incarcerated immigrants in ICE detention facilities. And then through the Orwellian named Migrant Protection Protocol, MPP, we have forced asylum seekers to basically live on the streets in Ciudad Juarez as they await their asylum application here in the United States. I would assume those two populations are particularly vulnerable, given that they don't have access to healthcare in some cases. They're probably already at wit's end, right? If you've just traveled 2,000 miles from El Salvador or Guatemala and arrived here and don't know what your fate is going to be, you're a stranger in a strange land, and you're cooped up with others. I've got to think this is a unique public health challenge. Any thoughts on how we could address that?
It's something that I worry about all the time, because if you think, these people do not have a voice that they can use, and all they want, and they're thinking about their safety of their children. And if I can't imagine the hardship that they're feeling and facing, and to have to say they're going to try to, I assume, would not want to divulge that they're not feeling well, and they're going to be scared to seek medical attention. And not only is that going to be really disastrous for that person, but also everyone around them, because the only way to contain this virus is by social distancing, and by keeping people away from one another and giving people the medical care and supportive treatment that they need. And so, people need to be able to say, I'm not feeling well. And this is a vulnerable population that is not able to use their voice and stand up for themselves. And I think it is hugely problematic. How to solve these issues is, I would have to leave to someone much smarter than me. I think there's incredible organizations out there that are working just in that way to try to fix this. But if you think about the issues that these individuals are facing, even when it comes to this flu, we are not doing flu vaccines in a lot of these detention centers. Mm-hmm. So something that we recommend for every single American, and that at every single pediatrician, their patients, they should get the flu vaccine. We don't let people work in the hospital unless they have a flu vaccine. If they don't get the shot, they have to wear a face mask every single day for 7 months. But we are not able to give flu vaccines to patients that are in detention at the border. And then there's undocumented people that are too scared to get healthcare, so they're not able to protect themselves. And while the flu vaccine is going to do nothing for coronavirus, flu is still out there. And if you're to get 2 different viruses, you're going to get a lot sicker than if you just have one. So it is a big public health issue, and it's not a public health issue that's just affecting that vulnerable population. Everyone in our country, whether you're American, undocumented, here with a visa, your health impacts the health of everyone around you. And we're seeing that with this virus. You could be perfectly healthy, but if your neighbor is not doing well, you're not going to do well. And it is on the backs of all of us. We're all in this together for the good, the bad, and the ugly. And we really need to be looking out for one another and trying to bring the best out and help one another.
Yeah, I think that you just made a really good point that's connected to what you were talking about at the outset of our conversation. You know, when we're thinking about the spread of coronavirus, you know, it can happen if we don't keep our distance from one another, if we congregate, if young people think that they're invulnerable and unwittingly become transmitters. By that same token, if we're not providing health care for everyone, including those who are undocumented and vulnerable populations in our communities and in our country, then we are probably accelerating the spread of viruses and diseases, and also furthering their suffering and misery. And again, have to point out, this is the wealthiest, the most powerful country on the face of the planet. We've got this if we want to, right? We have the resources, we have the capacity, we have the medical professionals who can provide this care. And it's also in keeping with the best traditions of this country. All of us at some point came from somewhere else to America, whether you came here thousands of years ago, whether you came here this week. And that's part of what makes us so strong and exceptional and extraordinary. And now is precisely the time to remember that, and not to draw up the bridge, close the gates, decide who gets care and who does not get care. That's such a mean, small, petty way to look at this. So I hope that each of us does all that we can, follows your lead, Nick's lead, these other amazing healthcare professionals. My sister Charlotte, who is a nurse in the ER here in El Paso, is on the front lines. Our friends Deb Jeet and Kunyong Kim in DC and in LA. Countless people who are risking their lives to help save the lives of others. And then you mentioned the everyday heroes, the clerk at the grocery store,
Yeah.
The person stocking the shelves so that we can buy toilet paper or noodles or rice or whatever it is that we're going to buy when we go to the store tomorrow. So many people stepping up in really difficult times.
Yeah.
So many people who've lost their jobs because they worked at bars or restaurants or in the entertainment industry, and there's just no business, and some of those businesses are closing down right now. So let's all find a way to be really good to one another. Find a way to donate your money, your time. Be smart, keep your distance when you can. And then last thing, and you don't have to comment on this, Christina, if you don't want to, but we absolutely have to keep the pressure up on our government. Not having tests is inexcusable. There's literally no excuse for doing that when other countries have figured this out. Not having personal protective equipment for healthcare workers who are on the front lines of this, absolutely inexcusable. We have the means. There's the law in place to literally command private manufacturers to produce this stuff in the quantities that we need and get it to where it needs to be. So let's keep the pressure up on the president, on the members of the Senate, U.S. Congress, and then also make sure that we do everything we can to make people whole. So we hope there's going to be a stimulus bill, and the funds in that bill go to the people who are most affected. I'm thinking of hourly workers, wage workers, people who just do not have the means to take care of themselves right now. They should be first in line to receive that help.
Absolutely.
But I'm so inspired listening to you. And again, I can't tell you how proud I am of you. And
I'm proud of you guys.
We love you. We're sending love from El Paso to you. And Amy.
And Christina, any calls to action that, you know, when people ask you, what can I do? What are you saying?
There are so many ways to help. Change.org has a petition right now to help get PPE or personal protective equipment to healthcare workers. So that's a great petition to look out for. And then thinking about, how do I help the most vulnerable in our community? So whether it's Meals on Wheels, helping to get school lunches to children whose families depend on those lunches to feed their children. There's so many different ways that we can help those that need us. And just the last plug, I feel very fortunate to be living in New York, and our governor has really been doing an exceptional job. One of the first things he talked about is that COVID testing and treatment will be free regardless of your documentation.
I think it's hers. Christina, we lost you just for a sec. Not going to touch my face. And we lost Christina. Christina, we love you. I guess that's the end of Christina, but I hope you found Christina as inspiring as I do. And I've known her as long as you and I have been married, and she's always been your kid's sister. And I've been at a distance, you know, proud of her that she's a doctor. But listening to her talk about what she does and what Nick does, and at the beginning of the conversation, she was emotional, talking about Nick, thinking about his exposure and the fact that he doesn't have a will, and you know, they have a 1-year-old. They have a 1-year-old at home, and yet they're on the subway every day, going into the hospital and taking care of patients who really need it. And then she also just had some really wise words about what we can do in our personal lives to keep each other safe and to be kind and good to each other. And then we help out, and how we help out the less fortunate and the most vulnerable in our community. So Christina, we are super proud of you, and we need more like you. And I know there are a lot like you out there who are unsung. Through you, we're trying to make sure that they all know how grateful we are for the work that they're doing.
And so, Christina, all of your friends, Anna and Hannah and Sarah, they're asking for you to put Nick on. So next time we'll have to have Nick join us. Yeah,
we want Nick and Matthew on the next one. So thanks everyone for everything that you're doing out there. We want you to be safe. We want you to be good. I want you to be kind to yourself, to your family, and to those in your community. I know you're doing that, and we're seeing so many hopeful, inspiring stories out there that you all have shared with us. So
Nick's watching.
Nick's watching. Nick says he's there. So thank you all, and keep checking in with us. We'll keep checking in with you, either here or on Facebook, or thanks to some good friends that we met in Houston a couple of weeks ago, and Molly, our producer, we're on TikTok now, and so we may do a TikTok live stream soon. Watch out.
I don't know that I'm ready for TikTok.
Okay. Well, there's only one way to find out. What's that, Molly? Molly yelled from the other room. Yes, you are. Okay, guys. We'll see you later. Be well. Bye.